Hi, I'm Dr. Tanisha Ward with Infinity Wellness Center, and today we're going to talk about poop. Why does it matter? Why does the consistency matter? What's going on with your bowels when you're having issues with your stool? The first thing I want to talk about is gut health. We are only as healthy as our bowel movements. I probably say that 10 times a week to patients. So if you're not going to the bathroom, if you're constipated, if you're going, I've had patients come in on the upside of not going 6, 7, sometimes even 10 days. But even if you're not having a bowel movement for 1 or 2 days, the analogy I like to use is whatever you had for dinner last night. Put that out on your counter, hike the heat up in your house to 98.6 degrees, right? Our core body temperature. What's gonna happen to that stool in 1 or 2 days? It's gonna rot. So that's a problem. So even if you're not going 1 or 2 days, the food is in there rotting. And that matters because you're not digesting the nutrients and the vitamins and the minerals you need from your food. So that matters. Also, if you're having a lot of loose stools, you're not absorbing things. So we're going to talk about what a good bowel movement looks like, why it matters, and what things can cause issues that we can test for. So first I want to go over our Bristol stool chart, my favorite poop chart. We look at this all the time with our patients. Why does this matter? Because if you don't have a good consistency of stool, you're not absorbing things. And 80% of our immune system's in the gut lining, and 90% of our brain chemicals, our serotonin, our dopamine, they're made in the gut lining. So if you're not having a good bowel movement, it can affect mood, anxiety, sleep, your immune system. If you're somebody who gets sick all the time, look at your gut health. So let's talk about that. A 1 or a 2 is constipated. A 1, I joke, I call them the little deer pellets. Those are usually dry and hard. A 2 is a very dry, hard stool. This is constipation. 3 or 4 is perfect poops. We call them the sausage and the banana. 4, 5, 6, and 7 are loose. This is where they're starting to fall apart. This is more watery, and this is definitely just watery. So every time a patient comes into our office, they rate their stool on the scale 1 through 7. So I know at least what the average has been the last couple weeks, the last time I saw them. So again, are you constipated? Are they loose? Or are they perfect? So that matters. If they're not consistently a 3 or a 4, we start digging into gut health. And what I like to do is run a stool sample. And the lab I prefer is the GI map test. And I love this test, and I'm going to go over it with you, what it tests for. There's multiple reasons why I love it. It not only tells us what bad guys you might have, it also tells us the good guys that you can have. And it's super simple. You take it home, you just simply collect the stool in a little container, you put it in a bottle, and you mail it back off, and then we get the lab results in about 1 to 2 weeks. So the GI map test is my favorite. It's much more thorough than most stool tests at most primary care physicians' offices, even more thorough than some gastro offices. And I'll go over kind of why. But the biggest reason is it shows us the level of your good bacteria, the good guys. Most stool tests are just looking for 1 or 2 specific bugs. This has multiple different pathogens. So I'm going to actually go over a lab test of what the GI map consists of. So once you send off the kit, we get the stools back, we get a very beautiful lab test that tells us what bacteria they are that could be present that are pathogens and what ones that should be there, maybe that aren't. So here's a couple examples of some of the pathogens that we can look at. C. diff. That's something that you could get from contaminated food or water. That can affect mood, energy. It can cause weight loss. It can cause weight gain. We'll see a lot of loose stools. We're looking for things like Giardia, norovirus. Those are some of the bacteria, parasites, and viruses we're looking for. H. pylori. H. pylori is a gut bacteria that in a small amount is okay and normal to have in your gut lining. If it gets above a certain amount, it is very, very much a problem. So much so that we can't say H. pylori causes stomach cancer, and we can't say if somebody has stomach cancer, they're always going to have H. pylori. What we do know is they're very much correlated. Most people that are suffering from stomach cancer have an overgrowth of H. pylori, which is Helicobacter pylori. So finding that in a stools test is huge if we can get that early on. And what we do is we use natural antimicrobials to kill it. Then we're looking at some of the good guys. So we're looking at things like lactobacillus. These are some of our good probiotics. A lot of people will just go to the store and pick whatever probiotic looks good, and that's most of the time sometimes fine unless you already have too much of that probiotic or you're already in a good range. Maybe you need other different probiotics that, Enterococcus is one of them that you may have low strains of. So what I love about this test, and I say this often also, is test, don't guess. We can find out exactly what good bacteria, what good probiotic you need, and we can implant it that way. And that's how we bring health to the gut. That's how we build up the gut lining. So I love that it has our good bacteria here. And then we start looking at some other bad bacteria. Bacillus is one of them that we see often. Streptococcus, staphylococcus can live in the gut lining in too much of an overgrowth, and those can cause constipation. Enterococcus bacillus can cause loose stools. So, and what's really interesting is sometimes I'll find both, and the person's like, well, I'm not having loose or constipated, or I'm having both, alternating stools, and it could be because you have multiple bad guys. We also can look at fungus. We look at different strains of candida that can live in the gut lining, and those can cause all kinds of issues. Those can cause gas bloating, they can cause skin issues. We're looking for cytomegalovirus in the gut. And then we move into parasites. I want to talk about parasites for a second. Most stool tests aren't thorough enough to pick up all parasites. Not even this test, which I think is the best on the market. It's only testing about 13 parasites and worms. There's thousands of parasites that we haven't even put names on. So sometimes a parasite test will come back negative, but the symptoms are there, and we will put somebody through a parasite cleanse. But most practitioners aren't even testing for parasites unless you've gone to a third world country or something and they really think it's a parasite. You can get parasites here in the US from letting your dog lick your face, eating on salad bars, eating sushi is a pork. These are places that parasites are all biting your fingernails. Kids can pass them. So worms and parasites are very, very common. The other couple markers that I love that are in this test that aren't in most stool tests are antibodies for leaky gut. We can absolutely diagnose leaky gut from this test, as well as gluten antibodies if you're gluten intolerant. And we can look at eosinophils. If those are high, we're thinking parasites even if one didn't show up. And the last part of this test that I love is it also shows some genetics of how well you may respond to certain antimicrobials. So we know this antimicrobial may or may not work for you. So again, I love the saying, test, don't guess. So if you're having gas, bloating, constipation, loose stools, you feel like you're not digesting your food, you've got weight gain or weight loss, that's worth noting. Some parasites can cause weight loss, added benefit. Some can cause weight gain, not the benefit we want. And the reason why it can cause weight gain is those parasites, even bacteria in the gut can do this. They're eating up all your nutrients, so your body thinks it's starving, so it'll hold weight. So any of those signs can absolutely be a marker for a gut dysbiosis, which means there's an imbalance in your gut lining. Also, again, I mentioned mood. If you're having a lot of mood disorders and issues, the first place we would do is look at your gut lining, see what's out of balance. And it sounds simple, but it's complicated. Once we find out what's missing and what we have too much of, we just simply add what the body needs, the good bacteria, and take away and kill what the body has too much of that it doesn't need, and then the body does the rest and it balances itself. So again, if you're having gut issues, give us a call, take a look at our link, and we can absolutely run a GI map test and figure out what's the core root issue of your problems.